The National Health Insurance Bill will now go to the National Council of Provinces for approval before the final consideration by President Cyril Ramaphosa. The bill was passed in the National Assembly yesterday. Its aim is to provide universal healthcare coverage for all South Africans. But what does that mean? We're now joined by Dr. Mvuyisi Mzukwa from the South African Medical Association. He's the chairperson. Thank you very much for your time this afternoon. Perhaps to start with an overall reaction or interpretation on behalf of the organization.
To you and to your viewers. We've been expecting this because we believe that this bill is being used for electioneering and not necessarily taking into consideration the dire need of South Africans who are in need of healthcare, and changes that are expected, from our government.
You mentioned that it is not taking into consideration the needs of South Africans, but the health minister would argue differently, as well as the Portfolio Committee on Health. So according to the document titled National Health Insurance Bill, as amended by the Portfolio Committee on Health, I'd like for us to take a look at what is contained in that document when they speak of strengthening primary health care services. They say, first, building a high quality and effective public health service delivery platform is the foundation upon which the health system will be based. The PHC service delivery platform will be facilitated and coordinated by the district health management officers, and services will be delivered in a comprehensive and integrated way. There will be an increased emphasis on health promotion and preventative services, in addition to improving curative and rehabilitative services. The delivery of primary healthcare services will be population-oriented, with extensive use of community and home-based services in addition to PHC facilities, and then it details how. This still does not go some way in trying to quell your concerns?
Well, Dudu, what you are saying is it's ideal. It's not what is happening on the ground. As we speak now, we're talking about South Africa that is in dire shortage of healthcare workers, sitting at about 30% of what is required by the World Health Organization in this country. But secondly, you've got dilapidated hospitals. You've got people who are moving out of the system because of the poor working conditions. The healthcare, the primary healthcare that you are talking about, as we speak, we've got about 20,000 shortage nurses in short in the state. So I'm not sure, it's good to sing about those things and promise the world, South Africans, that, that's an ideal world. But that is not what is being felt by South Africans at the moment. Even healthcare workers who are bent out, who cannot enjoy a conducive, safe working condition. But we all aspire to that equitable access to healthcare that is affordable, that does not lead to financial hardships from South Africans. But we're speaking about an ideal case. This is not what is happening on the ground, and this is not what we can expect in the next 10 to 15 years.
Let's take a look then, because you will find some sectors of the population, I believe it's some 9 or 19 million, if you could please help me with the stats there, of people that rely on medical aids. And then in the document it speaks of the role of medical schemes. I wonder if we can bring that up so our viewers can also see it. And that reads, once national health insurance has been fully implemented as determined by the minister through regulations in the Gazette, medical schemes may only offer complementary cover to services not reimbursable by the fund. And so with your engagements with that sector, what is it that people with medical aids need to understand?
Well, that is what is being envisaged, but you recall that all those things are not defined. What is complementary is not defined by the bill, but also having a look at what is happening in the UK under the National Health Service. We are seeing a backlog, as you know, about 7.4 million of people who are waiting to see doctors or else to be done operations or procedures. And they are seeking healthcare elsewhere, including the recent strike by healthcare professionals, junior doctors, who are on strike in the UK as we speak for about 3 days, demanding pay because the system cannot cater for those. But on top of that, there's a shortage, a dire shortage of nurses, sitting at around 40,000 shortages, to be able to capacitate the system. So you're talking about South Africa that has not started anywhere in terms of employing the system, the people. But on top of that, the other sources of revenue, like for example, the compensation fund, we don't see the role of the compensation fund there. So it means all those beneficiaries will come under the NHI, and I don't think we'll be able to cope. I mean, we'll just leave employers scot-free, without any contributions to the well-being of their people, which I think is a very problematic area. The medical aid, as far as I know, that money is protected by the law. It's not that you are going to just simply have access to it simply because you've got a bill act in place. It is going to be the people of South Africa, the contributors to that fund, that are going to determine what is going to happen. But I don't believe that we're going to get rid of medical aid as I look at it.
Okay, let's go back to that document and under the strengthening primary health care services and take a look at this. So you mentioned that we are already facing a shortage in terms of staff, and healthcare facilities are stretched more so in far-flung areas and in some urban areas in terms of a shortage of staff. But here it reads, PHC outreach teams will be allocated to households and they will visit them on a regular basis. They will provide health promotion education, identify those in need of preventative or rehabilitative services and refer them to the relevant PHC facility. Another interesting one that speaks to school health services will be provided to improve the physical and mental health and general well-being of school-going children, including pre-grade R, grade R up to grade 12. And then, to your point of medical aids, it says contracting arrangements will be explored, including improved sessional appointment contracts to deliver comprehensive PHC services from government health facilities or mobile health posts, and contracts with multidisciplinary group or network practices operating from private premises. I think 4.5 also. Private primary health care providers will be drawn on to increase service delivery capacity and to improve access of needed health services, especially in underserved rural and informal urban areas. And so you read all of this and you think, what if then there is so much resistance? What is going to break the impasse? Because this is done in the name of equitable health care and addressing the wrongs of the past.
Remember, the debate is not about whether we need a reform or not. We all agree that a reform is needed, but the debate is on the how. Because if you're talking about all, those are simply promises, an ideal world. It's not like what is happening on the ground. Hence, we are saying to government, if you are serious about what you are promising the people, please make sure that you employ enough healthcare workers on the ground so that they are able to deliver this. Because talking about equitable access, you must have enough of those human resources in terms of the urban versus rural, private versus the public, and also the peri-urban areas. You can't be talking about equitable access when you have dire shortages, when actually you cannot at the moment even attempt to capacitate the healthcare sector. When actually you are focusing one on the finance part, what about the leadership and governance part? I mean, you've heard the ombuds talking about the governance and leadership in Gauteng, in the Eastern Cape, and many other provinces. That has not been addressed, and that's one of the elephants in the room.
So this goes now to the National Council of Provinces. What then is your message to the President? Will you be engaging him? Will you be petitioning him, rather? Because ultimately he will then let the country know whether this will pass or it must go back for review.
Well, we believe that the president is going to look at the concerns of healthcare professionals because they are the backbone of the healthcare service. And I do think that the president don't want to pass something that is going to cause a mass exodus of healthcare workers in the country because there is no attempt to address their concerns. And I'm sure the portfolio committee, if they are serious about this, they will come back to healthcare professionals, have a serious engagement, and not be seen as people are just making noise, as we see the attitude from some of the leaders and some of the health officials who refer to these concerns as just noise. So I do think that the president will really sit down with his advisors and take a serious look at our concerns.
Because even according to the document, there wasn't full-on consensus about passing this bill among some of the members. Thank you very much for your time this afternoon. Dr. Mvuyisi Mzukwa is with the South African Medical Association.